Okay, good morning. Why don't we go ahead and get started? I know a few people are trickling in. Welcome. My name is Darshan Mehta. I'm the Associate Director of Education for the Osher Center for Integrative Medicine here at Brigham and Women's Hospital and Harvard Medical School. And I'm also the Medical Director of the Benson Henry Institute for Mind-Body Medicine at Massachusetts General Hospital. Before I introduce my colleagues here, wanted to just quickly remind everyone here that on Friday, November 18th, the Osher Center for Integrative Medicine is hosting the Integrative Medicine Network Forum. Some of you may have attended the Network Forum 2 years ago, and we are having another event this fall. It's again will be an exciting event, really bringing together the Boston-wide integrative medicine community, including clinicians, researchers, practitioners, educators, and anyone who is genuinely interested in understanding the science and education and clinical applications of dimensions of the field. Just to give our keynote is Dr. Alessio Fasano, who is eminent pediatric gastroenterologist at Massachusetts General Hospital, and we look forward to seeing all of you there. The information for registration, for those of you who have not registered, is on the Osher Center website, www.oshercenter.org. If you have any questions about registration, please, at the coffee hour after this event, please see Veronica. Where's Veronica? Oh, she's out in the hall. But if you have any issues getting registered, registration is required, but it is free. So we look forward to seeing as many of you there. And it's from 8 a.m. to 2 p.m., and it's really an exciting event. Those of you who were there in the past iteration can attest to that as well. So, without further ado, I'd like to introduce my colleague and friend, Dr. Patty Arcari, who is the Program Manager for Meditation and Mindfulness at the Zakim Center for Integrative Therapies here at the Dana-Farber Cancer Institute. And she will be providing introductions for her set of colleagues here. And the clinical presentation that we'll be discussing is Reiki therapy and conventional medicine, an integrative and comprehensive approach. So, Patty?
Good morning, and thank you, everyone, for being here. We're here today to present a treatment strategy that represents what we believe is the essence of an integrative approach to care. And we'll introduce Dan, a 64-year-old man who received a stem cell transplant in April of 2015, and as you'll see, is today doing quite well. Dan also received Reiki as a tool to aid in his healing, and he'll describe for us his direct experience of this therapy. For all of us clinicians working in an integrative practice setting, we understand deeply the primacy of these healing experiences for our patients. It's why we do this work and why we're so passionate about it. In this morning's talk, you'll also hear from clinicians providing Reiki in a number of different healthcare settings, including Dana-Farber, Spaulding, and Brigham and Women's Hospital. And you'll understand how this practice has impacted both providers as well as the people they serve. I'm Patty Arcari from the Integrative Nursing Program and the Zakim Center for Integrative Therapies at Dana-Farber. As Darshan said, I run the meditation and mindfulness programs there, and with the help of many, have recently begun building our Reiki program. We began with an initiative to train 50% of our nurses in Reiki and set the goal to achieve this within the next 2 years. In addition, we're creating a volunteer Reiki program so that we can achieve our overall objective of being able to provide a Reiki treatment for any patient walking through the doors of Dana-Farber on the day of their visit. Before embarking on this ambitious strategy and agenda, we did our own review of the literature about energy-based modalities to determine which intervention would be most efficacious for our patients. I'll share with you now the results of that due diligence, the decision to choose Reiki, and the biofield science that underpins it. This emerging science, we're hoping, will provide a theoretical framework for our work and also serve as a guide for future outcomes research of the practice. As we begin to look at the definition of Reiki, we saw pretty quickly how it resonated with the principles of integrative nursing as articulated by Kreitzer and first described by Weil in integrative medicine. Using the person's own innate capacity for healing, Reiki is a non-invasive therapy which impacts the whole person and their environment. As we move forward in this new era of patient-focused healthcare, we must acknowledge and incorporate this mind-body-spirit wholeness into the fabric of how we provide care. Our patients are demanding it. It's our responsibility to respond, and Reiki is a tool to accomplish this. So what is Reiki? In 2012, NCAM defined Reiki as a process where the practitioner guides energy to the recipient to assist the innate healing of the recipient and facilitate self-healing. The common interpretation of the word Reiki is universal life force energy, and soon you'll hear Libby Barnett describe the practice as it was identified hundreds of years ago in Japan. Reiki focuses on intentional presence, being with the patient, and focuses on physical touch, helping to facilitate deep relaxation, restore balance, and cultivate well-being. The sessions can last anywhere from 5 to 90 minutes. The recipient is fully clothed as the practitioner places hands lightly on the body in a set of sequenced hand positions. In a study in 2009, Vitale identified that nurses using Reiki for self-care during their workday reported feeling more calm, centered, and able to care for others. But as we began to look at the literature in support of Reiki, like many, we found the state of the science was weak. A systematic search using Medline, Cinol, PsycInfo, and Embase, with Reiki as the keyword, produced disappointing results. Medicine, nursing, and psychiatry alone, it seemed, were unable to provide strong evidence for this holistic intervention. As if in direct response to this need for a more holistic approach to building the science, Global Advances published this edition in November of 2015. Reporting on an interdisciplinary scholarly meeting called Biofield Science and Healing, the journal issue described the effort to foster collaborative inquiry and accelerate strong empirical research in the area of biofield science. This scholarly meeting brought together researchers and scholars representing a wide range of scientific disciplines, including biophysics, physics, biology, clinical psychology, psychoneuroimmunology, psychoneuroendocrinology, the neurosciences, engineering, and medicine. One of the outcomes of this meeting was the creation of the Consciousness and Healing Initiative, a collaborative organization supporting interdisciplinary science, which hopefully we'll be seeing much more of in the years to come. So, how did this group define biofield science? Well, they called biofield science an emerging field of study which aims to provide a scientific foundation, which we saw was lacking, for the complex homeodynamic regulation of living systems, which is what we all do. The first The first group to propose this term was actually brought together in 1992. It was a committee of CAM practitioners and researchers that were convened by what was then called the Office of Alternative Medicine at the NIH. And they described this as a way to bring together diverse modes of energetic healing, including therapeutic touch, healing touch, and Reiki, all under a single term. Moving up to the year 2016, what we're now calling the National Center for Complementary and Integrative Health has currently included biofield therapies in its strategic plan for mind-body research, and it is now a funding priority at NIH. Hopefully, we'll begin to see the results of this funding in newly published research in the months and years to come. So, as we've said, biofield is a field of energy, and Jan and colleagues in 2015 described it as information that reflects this homeodynamic regulation, and as such, influences and is influenced by consciousness. Now, we're all aware of the challenges that have been present in the years past looking at and trying to operationalize consciousness. But examples of these clinical biofields include tests and strategies that we've all heard about. The electrical and magnetic fields generated by arrays of heart cells and detected by EEG is a biofield. In the EEG, it's the electroencephalogram that's giving us the neural biofields as well as magnetoencephalograms. So examples abound, and the hope and promise is there, but what is the current state of the science in Reiki research as we sit here today? I apologize for the blurry slide, so much for an iPhone being able to translate onto a PowerPoint slide, but I will guide you through this. A systematic review that was published in 2014 attempted to calculate the effect of Reiki for pain and anxiety in randomized clinical trials. From 49 articles examined, they found 7 studies which met inclusion criteria, and those criteria included studies that used randomization and a control or usual care group, studies that used Reiki in one arm of the study, those published in 2000 or beyond in peer-reviewed journals in English, and those that measured pain and anxiety. The sample sizes ranged from 6 to 160 participants with a mean number of 26 subjects. They examined a variety of populations. 3 of the studies looked at cancer patients, 2 studied Reiki in surgical settings, and 2 looked at adults living in the community. All but 1, coincidentally, the study that was done here at Dana-Farber and Benson Henry, found at least one statistically significant result on the outcomes of pain and anxiety for the Reiki intervention. The study by Baird in 2011 is actually that study that didn't show positive effects for Reiki. It compared in a population of prostate cancer, it compared the use of relaxation response therapy with Reiki and found that relaxation response produced a positive outcome, but not the Reiki. In 2003, also looking at cancer patients, Olson and her group found significant differences in pain scores with patients who were treated with Reiki plus opioids as compared with patients treated with opioids and simply rest. In 2007, Tsang and her colleagues looked at patients recently completing chemotherapy and found significant differences in anxiety for patients treated with Reiki from treatment number 1 to treatment number 4. In 2006, Vitale and her colleagues found significant decreases in anxiety and pain in women who had had hysterectomies and were treated with Reiki as compared with those who received just usual care. In 2007, looking at subjects with type 2 diabetes, They were given, there was a 3-group design. One group got Reiki, one group got sham Reiki, and the third group got was the control group, and they found that diabetic neuropathy pain was significantly decreased in both the Reiki care groups, the sham and the active treatment, but not in the normal control group. And then finally, we see a study from 2010 by Richardson and Spross that showed significant decreases in anxiety and pain with Reiki therapy within the control group and with community dwelling elders. So the community dwelling elders were studied and found that Reiki did in fact improve their pain and anxiety in an outpatient setting. So, in an effort to determine the current state of Reiki research, the Center for Reiki Research was formed. The goal of the center is to provide and compile a list of current evidence-based research on Reiki and make this information easily accessible to both the Reiki and scientific communities online. So if any of you are looking for evidence to support your intervention, this website is available and open to all. From this group, the touchstone process evolved. The center describes the touchstone process as a rigorous peer review method for analyzing a group of scientific studies in a particular field. It produces a set of critical summaries derived from what they're calling an impartial and consistent process. So as you look here, as we are working to advance the state of the science, it's the column on the far right in the green that lists the studies that provide what they're calling solid evidence of positive effects so that we can build on this research. And there are actually 3 studies here. The first on the bottom of the right-hand column talks about measuring stress response in rats. And they were able to show decreased stress response in the lab between rats who received Reiki and those who received sham Reiki. Now, the explanation of the study is pretty elaborate, but they basically describe that in a lab setting without confounding variables, we're more easily able to isolate the treatment and draw conclusions. And there were actually 2 studies in 2006 and 2008 that showed a decreased stress response. The other study looking at depression and stress by Shore and her colleagues showed significant decreases with the use of Reiki. And then the study on well-being in Reiki practitioners, which I referenced earlier, was done by Mathay and showed this is promising as well for areas of future research. But in addition to the lack of randomized controlled trials that we saw earlier, there are other methodological issues that continue to confront the area of Reiki research. The first is sample size, and as we described earlier, most of the studies describe small sample sizes, and that makes generalizability to the larger population extremely difficult. A second issue is related to dose, and when we say dose, we mean not only the length of the Reiki treatment, but the type of hand positions used in the protocol. Many studies lack clarity about timing and position, and without this information or this standardization of protocols, again, the ability to generalize, make comparisons is difficult. Timing of the intervention could also be important to the success. For example, is a pre-op intervention before breast biopsy, delivering Reiki, best given immediately before the procedure, or is there a window of days or hours before which it can demonstrate an effect? We just don't know. And the last issue has to do with practitioner selection, and this has gotten quite a bit of attention lately as well. The challenge is how to determine a practitioner's skill set in terms of their healing abilities. In an article by Jan Cohen-Lutendorf and colleagues, they describe what's needed is a procedure to determine that Reiki providers are able to reach a criterion level of effect before they're involved in any research. So I see all the practitioners sort of wincing. How do we do that? That's the challenge. So, seems that the bar is set pretty high. But, given the premise that we began with, that it is the patient experience that should also drive the delivery of the intervention, the work will continue as the research process matures. Libby Barnett, our pioneer, will now more fully describe the patient and provider experiences as she outlines the path that she has taken to lead us to the place where we are today with the use of Reiki in healthcare. Thank you.
Good morning. So pleased to be here. Reiki's a Japanese energy therapy, and it came into the U.S. in '73, and I became a Reiki practitioner in '79 after having been a medical social worker at Mass General. My passion, as Patty said, is to integrate Reiki into conventional medicine. I've trained at many facilities and taught over 10,000 people. In '89, nurses started coming to class. It was so exciting. I can remember the first time a nurse called and said, "I want to come to a Reiki class." They thought that these benefits, pain relief, relaxation, comfort, might enhance their patients' well-being. In '91, 2 nurses came from York Hospital. They wanted to support their patients during chemo. After class, I visited their infusion clinic. They had transformed it into an oasis of comfort with flowers, soft lighting, pillows, and Reiki. Their patients reported feeling less anxious and more relaxed. As one patient said, "Before Reiki, I felt so stressed during my infusion. With Reiki, I sail through my infusion and go out to eat with friends afterwards." In '92, Peggy Flood, an oncology nurse from Emerson Hospital, called to invite me to talk to her staff. The staff had witnessed her helping patients worry less and tolerate procedures better, and so they were open to hearing more about Reiki. Initially, nurses learned Reiki to enhance their patients' well-being, yet they soon discovered Reiki could also benefit their own well-being. As one nurse said, "I came to class to get a tool to help my patients. I left class with a self-care tool for myself as well." She would often refer to doing Reiki as her in-breath time because Reiki calmed and relaxed her as she did it on her patients. In '96, after taking class at Inglewood Hospital in New Jersey, Jenny Morabito, assistant director at Newark Foundling, was still very skeptical. We strategized that she would choose 5 patients and do a few minutes of Reiki several times a day. Thomas was a 5-year-old who would repeatedly injure himself by banging his head and hands. After receiving Reiki for only 10 days, his self-abuse decreased 80%. When I spoke with Jenny, she said, "It still doesn't make much sense, but it clearly can't hurt, and it just might help. And my nurses need more tools to manage the children's pain. Besides, it just might help us take better care of ourselves." Sometimes the key person who opened the door not only knew about Reiki, but had actually used it. Ann Aimling, on faculty at Yale School of Nursing, found Reiki so beneficial in her recovery from breast cancer that she wanted every nursing student at Yale to have Reiki in their toolbox. As the students experienced Reiki's relaxation, they enthusiastically embraced it and used it to help manage the stress of nursing school. Anne wrote one of the first Reiki articles published in Holistic Nursing Practice in 2000. In 2003, she encouraged her doctoral student, Pamela Potter, to conduct a study at the Yale Cancer Center on the effects of Reiki in relieving stress in women facing breast cancer treatment. Potter's work was published in the Journal of Holistic Nursing. By 2004, an increasing number of hospitals were wanting Reiki. Following a class at New York Presbyterian's Pediatric Oncology Department, one nurse commented, "As a charge nurse in the NICU, I have observed nurses doing Reiki on each other during stressful days. Reiki calms and centers us." Another said, "I use Reiki during spinal taps, IV starts, and blood draws. Reiki helps the kids muster up their courage." Reiki has continued to expand within healthcare not only because of nurses, but other healthcare professionals who are also incorporating it. A patient receiving Reiki from a PT at Spaulding commented, "Reiki doesn't always fix my pain, but it always soothes my heart." Reiki's integration in healthcare was also fueled by patients asking for it. The majority of hospitals in the Northeast now have some form of Reiki, whether it's a Reiki-trained staff person or a full-fledged volunteer program. Brigham and Women's has created an outstanding volunteer program of about 70-plus Reiki practitioners. Recently, a Brigham nurse came to class saying, "I came to class because I saw what a difference the Reiki makes in the comfort of my patients." A volunteer program was recently launched at Dana-Farber, and Reiki classes are available for oncology nurses because of a gift of a generous donor. So anecdotal evidence has established Reiki as an effective energy therapy. Soon, more research will provide more solid science, making Reiki more acceptable to evidence-based medicine. Now, Bambi Mathay will present Reiki at Dana-Farber.
Thanks, Libby, and thank you, everyone, for being here this morning. So my piece is to present the Reiki history at Dana-Farber, mostly the clinical history. And as most people know, Dana-Farber is an outpatient facility that serves the oncology population. This is where the Leonard P. Zakim Center for Integrative Therapies is located. In 2000, Reiki was chosen. In 2000, Reiki was chosen as one of the modalities when the Zakim Center opened, because this was one of the modalities that Lenny Zakim used while he was receiving treatment for his cancer diagnosis. At the time, there was one nurse providing the service, and very limited hours. So you could just imagine that that was all we had at the time. In 2003 and 2006, there were two separate seeds of awareness, or in layman's terms, opportunities for other practitioners to practice Reiki, since both of the licensed oncology massage therapists that were hired separately, my colleague and myself, we were also both Reiki master practitioners. However, the timing at the time was not there. In 2007, the hands-on care program was developed for volunteers to do hand massage. This was the Zakim's own take on the benchtop to bedside model, where we went from massage table to providing and serving our patients in the infusion chairs. And although this was not a Reiki project, this would actually serve as a model for all of our infusion services as well as outreach. This is an ongoing project at the moment. In 2010, the timing was right. Circumstances led to the therapist to be allowed to deliver Reiki services, and that increased the utilization of Reiki. In 2014, the Zakim Center gets a funding for what we call the R&R project, with the therapists providing a choice of Reiki or foot reflexology in both our adult and pediatric infusion areas. This, too, is an ongoing project. In 2015, the Integrative Nursing Group starts a Reiki training for nurses, and this further expands the reach and utilization of Reiki in the infusion areas where the Reiki-trained nurses can provide Reiki while the patients are receiving chemo. In March of 2016, we started our Reiki volunteer pilot, drawing from ideas of the hands-on care program and successful programs such as the Brigham and Women and Spaulding, which you will be hearing in a few minutes. And 2 volunteers were sent to select infusion floors to provide Reiki. This is a very well-received pilot and is ongoing and is also the inspiration for us to submit a support for rollout of a full volunteer program, which hopefully will start in October of this year. This model is, we're showing our hope, a patient-centered Reiki model, where the hope is that there will be many ways for our patients to access Reiki. The arrows, the blue and yellow arrows, represent the interconnectedness of this model, very similar to how Reiki is an energy force that connects and supports all life. The 2-way blue arrows in the center represent patient-to-practitioner interconnectedness, because knowing that when we provide Reiki, we too are receiving from the universal life force as it flows through us. The yellow arrows on the outside of the circle or the star represent the interconnectedness of all points where our patients can access the service, including at some point their home and their own self-care, and shows that the model allows for a continuum of comprehensive care wherever patients are. And next, we'll hear about Judith's experience as the lead nurse for the Spaulding Rehabilitation Program.
Good morning, and thank you all for being here, and thank you for the invitation to present our work on Reiki. I am from Spaulding, and prior to retirement, I was the research nurse coordinator for traumatic brain injury, and since retirement, I'm the integrative medicine coordinator, which I'm very much looking forward to. I am here today as a member of the Dana-Farber Reiki Volunteer Think Tank, which is responsible for designing the process and structure of the Reiki Volunteer Program and then disseminating information about Reiki practice. My experience with Reiki comes through personal practice, the personal experience as a patient, as a volunteer in the Brigham and Women's Neuroscience ICUs, and through collaboration with the Brigham, bringing the Reiki Volunteer Program to Spaulding. Brigham has been very supportive. They met with us. They shared their challenges of implementation, and they made many of their materials available to us so that we didn't have to reinvent the wheel. And this made it very easy to develop this program in Spaulding. The ICU nurses continue to be extremely supportive of Reiki, and I very much look forward to my time there. It has also been a pleasure being part of the Reiki think tank, sharing our experience and witnessing the dedication and commitment of the Dana-Farber staff to bring this wonderful passion and practice to their patients. The potential volunteers that they have screened are really enthusiastic about being involved and committed to being involved in this initiative, and they bring a great diversity of life experience. Spaulding has an integrative medicine task force, which is chaired by Dr. Rick Leskowitz, and we champion the development of the Spaulding volunteer Reiki program in response to requests to this committee to provide Reiki to our patients and their families. The Reiki Volunteer Program started on May 14th, 2013, and at the end of last quarter, we have provided 1,927 Reiki sessions to adult and pediatric patients, families, and staff. We have 7 volunteers who are very dedicated and have contributed their time, energy, and skill in making our program a great success. They're also a lot of fun to be around, and they also show so much joy when they are presenting Reiki to our patients. Patients are referred to Reiki through self-referral, family, or clinical staff. No doctor's order is needed. And many of our patients come from the Brigham and may already have experienced Reiki here and expect to have Reiki at Spaulding. Or they may be familiar with Reiki through their own personal experience in community living. Patients report being very relaxed, having decreased pain and anxiety, and improved sleep. Family members report a decrease in their stress levels and improved relaxation. Both groups have reported being comforted by Reiki touch. Generally, when we talk about Reiki, we talk about energy, but I believe it is important to reflect on the touch aspect and its impact on healing and well-being in our increasingly high-tech and digital environment. I believe that touch is becoming a lost art in medicine and nursing. Since one of the goals of rehabilitation is to empower the patient to regain as much functional independence as possible, therapists trained in Reiki use it during their sessions. They report that the patient makes greater progress during the therapy because muscles relax, pain and discomfort is lessened, as well as their anxiety about having pain and discomfort during the therapy session. Spaulding is also fortunate to have a Reiki training program for staff, which is made possible through the generosity of a donor. This donor, who is also a Reiki practitioner, created the grant after the acute and rehab hospitalizations of her 3-year-old child who experienced a traumatic brain injury from a fall. She believed in integrative therapies to enhance traditional care and started introducing music, Reiki, nutrition, and acupuncture in the acute care setting, continuing on through rehab. At points along the way, she encountered a bit of resistance from hospital staff, but she persevered and educated staff along the way. Her child has fully recovered, to the amazement of his providers. He is 11 years old now. He skis, and his tennis instructor has complimented him on what a great backhand he has. Our training program began in March 2012, and 82 staff from around the Spaulding Rehab Network have been trained, including 2 attendings, 5 residents, and 1 fellow. I hope that the presence of Reiki grows in the hospital setting as a way to offer comfort to patients and families, as well as staff. And for caregivers, Reiki is a great tool for self-care. In one point, I do advocate for research. I have many years of research background. And while we find our way in trying to mature the evolution of the methodology to capture the effectiveness of Reiki, I really hope that we do not negate the patient experience, even though we can't prove it. Thank you. Our next speaker is Kathy Guimond, who is a nurse here in the bone marrow transplant unit, and her patient Dan, who are going to share their experience.
Good morning. Thank you all for being here. I work on the bone marrow transplant unit right here at the Brigham. The bone marrow transplant patients are on the unit for 3 to 4 weeks, or sometimes even longer, depending on how their course goes. They are there, just fighting for their lives. For most, it is their last hope. For some, they never make it home. These patients are more than just their disease or treatment plans. They are someone's mother, father, brother, or sister. They come in with many concerns and stressors: financial, emotional, spiritual, and physical. As a nurse for many years, I've wanted to do something more for my patients other than just traditional Western medicine, such as chemo and radiation, as those just treat the disease. I wanted to make a difference in my patient's journey, no matter what the outcome, and include body, mind, and spirit, as the essence of integrative care is taking care of the whole being. As a Reiki practitioner, I came across a call for the Integrative Nursing Practice Award. The Integrative Nursing Practice Award is funded by the Dana-Farber Integrated Nursing Program and is a competitive award available to oncology nurses throughout the Dana-Farber, Brigham and Women's, and Children's Hospital continuum. Nurses interested in bringing integrative interventions into their patients' settings are encouraged to apply, and so I did. I was fortunate enough to receive this award for the 2014-2015 year. This is when Reiki really got grounded into my nursing practice as it stands today. For a whole year, I came in every Saturday for 4 hours and gave Reiki treatments to the BMT patients, families, members, and staff members. The treatments lasted for 20 minutes. They had the choice to listen to music or to just have silence during the treatment. Most preferred silence. I collected data pre and post Reiki treatments. The quantitative data showed a significant decrease in pain and anxiety. The qualitative data was just as amazing. Here are a few quotes from the patients. Relaxed a little, and the human touch to touch was comforting. It was relaxing, and the human touch is always welcome. Relief of high pain level all day, and feeling relaxed. I felt like I was waking up from a good night's sleep. It was very relaxing. These are powerful comments from the patients. The energy goes where it's needed the most on any given treatment, the body, mind, and our spirit. I am honored today to have one of my patients here, to share his Reiki experience. Dan is a 64-year-old gentleman. He's married to his wife, Sue, who is also here today. They have 3 adult children. Until his illness, he was working in the wholesale electrical distribution center in sales and administration for 36 years. He had no significant past medical history and had just gotten a clean bill of health in March 2014. By the fall of 2014, Dan started developing pleuritic chest pain. With several visits to the emergency room, his cardiac workup was negative, and a chest CT was also negative for pulmonary embolism. But repeat blood work showed significant changes, so he was emergently referred to a hematologist. After having a bone marrow biopsy, Dan was diagnosed with ALL, acute lymphoblastic leukemia. Dan was immediately started on a chemo regimen. He had 4 lumbar punctures with intrathecal chemo and radiation treatments to the brain prior to his stem cell transplant. On April 9, 2015, Dan underwent a reduced intensity allo stem cell transplant on 6A. Dan is doing well, though he is followed closely as he has chronic skin and eye graft versus host disease complications from the transplant. His daily medications are prednisone for the skin, GVH, Lodamax and Restasis for the eye, GVH, fluconazole, acyclovir, and Bactrim for prophylaxis, and Cafacil for mouth sores. The one thing I remember, when Dan was getting ready to be discharged, he shared with me he was leaving a lighter man. And I knew exactly what he meant. To this day, I am grateful that I was part of this and able to use the tool of Reiki. Please welcome Dan to share his Reiki experience.
Good morning. I am honored to be here today and flattered that Kathy Guimond invited me to share my Reiki experience. In the weeks prior to my stem cell transplant, there were countless hours of worry, and many sleepless nights. I did my best to put on a brave face for my family and let them know that all would be fine. My wife, Sue, and our daughters had Reiki experiences in the past. Each of them excitedly explained and shared their individual experience and felt it would be beneficial to my well-being. At this point, it was not on my priority list. This cancer had changed my life, and I was determined to fight and not allow it to defeat me. The human spirit is very powerful, and I needed an avenue to support that belief. My conditioning began shortly after admission and would continue for 6 days. Sue had inquired with the staff about Reiki and felt it would ease my concerns. Within the hour, we learned one of the attending nurses performed Reiki, and they would make the necessary arrangements. Later that day, a nurse with an infectious smile and soothing voice came to visit. She explained the process and was very positive and upbeat. Her enthusiasm and belief in Reiki healing was all I needed to hear. I remember saying to myself, when do we begin? The memory of a calming and relaxed feeling will remain with me forever. As Kathy passed her hands over my body, I could sense the spiritual energy and knew that all would be fine. Cathartic is the word I mouthed as I awoke from a beautiful experience. Tears rolled down my cheeks as I let it all out. I felt embarrassed in allowing my emotions to get the best of me. I was raised in an environment where men don't express such feelings. Months of holding it all in came pouring forth. I remember my wife and Kathy both whispering to me, "It's okay." Is Reiki the panacea and remedy to all of life's twists and turns? I am not qualified to answer that question. Did Reiki help me through a difficult and uncertain period in my life? Absolutely. In closing, I'd like to personally extend my sincere gratitude to Kathy Guimond for her personal and spiritual guidance and for friendship. Life is too short and precious, and I'm committed to celebrate it each and every day. Thank you.
Thank you, Dan, for such moving words, and thank you to the team. I'm going to invite them to come up front, if we can have the lights. So as people are coming up to the front, I just I just wanted to just appreciate just the powerful stories that have been presented here today. And as someone lives at the intersection of the patient experience, education, research, I'm curious, given that there's such a beautiful collaboration already that exists between the hospitals, is there an opportunity, or has a database been created to capture, since many of you have helped each other in the different hospitals, to capture and quantify more robustly some of these treatment experiences?
Not yet. But in the spirit of a collaborative, in addition to the practitioners you see here, we've also assembled a group of Reiki providers, thanks to Libby's training, who also are OSHA researchers. So we are working on creating a protocol to begin to collect the data that we're seeing in both the nursing and volunteer population. So it's a work in progress.
Great. Okay. So as we're opening up to questions from the audience, one question that just comes to mind is that there are many different energy field approaches, bioenergy modalities. And I'm curious as to how you differentiate, or if people differentiate differences between Reiki, therapeutic touch, which has been in the nursing profession for decades, Qigong, which is another, energy. So how are the modalities similar and or different?
I can speak to it if. So you're right, Darshan. Therapeutic touch has been present in the nursing literature for many, many years, and I think the primary difference between that and Reiki is that therapeutic touch is hands-off, where most of the Reiki that we're providing is hands-on, as well as requiring a set of 5 very specific steps that have to do with strategies like unruffling and sort of terms that get a little complex. In terms of healing touch, I'm not too familiar with it, except to know that in order to practice it, you need to go through 7 very rigorous training platforms in order to be able to integrate it into practice. And Reiki just seemed like the best fit, simplest, best fit. Also, the fact that it's utilized everywhere shows you that it just made the most sense.
Questions from the audience?
Question about just before I got into med school about 40-something years ago, I worked as an orderly in a hospital, and I worked in the coronary care unit, and that was the best experience of my life for training in medicine. I learned, for example, that the healing environment in a hospital is about 90% due to nurses and maybe 10% to physicians, if we're lucky. One of the highlights of I worked the evening shift, and one of the highlights every evening was the back rub. And there was a kit, and it had a cloth and a bottle of some kind of cream. And the nurses seemed to always have time to give a back rub. And you could watch the monitors. Blood pressure came down. Cardiac arrhythmias decreased. Heart rate slowed. I didn't go question them about how they were feeling, but they begged for their back rubs. My question is, what is the difference between having time for a caring nurse? In general, they were caring and looked forward to it as well. Giving a back rub versus being trained in Reiki. Are they the same? Is there some total difference that you would contrast?
Would you like to answer? Okay.
Certainly a back rub is delicious. The theory behind the Reiki is during the attunement process in class, people are actually connected to this energy that the Tai Chi master might use and the Qigong person might use. We're all working with universal life force energy. It's just sort of the form. What people will report after being attuned to Reiki is that there's less depletion. So sometimes people will do great back rubs and get really exhausted. And with Reiki, it seems that you're fueled in the process of doing it. So there's less depletion, and you can just go forever with the Reiki from the practitioner's point of view. From the end result of the patient, they'd probably love, though the best of worlds would be a Reiki-trained nurse who's doing the body, the back rub.
And I would just like to add that I'm not sure how often back rubs are being done these days with resources being what they are. But with Reiki, a nurse or a doctor has the opportunity to provide Reiki whenever you do anything with a patient. Whenever you put your hands on a patient, there is the opportunity for the Reiki energy to flow. And I think that is a magnificent gift to both the provider and to the patient.
And I'm also going to add, since I'm a massage therapist, that I love doing back rubs or massage, and I'm very grateful because the nurses did pave the way for massage therapy to actually be in clinical practice. And it's, I think, like if you look at methodology, massage approaches the body more on a physical level, basically like they call it manipulating the soft tissues muscle, whereas Reiki approaches it from a more energetic level, and as already mentioned, can be done in any setting when you put your hands on and Reiki is on.
Add, the back rub works more on physical, where Reiki works physically, mentally, and spiritually.
I work on 12D, which is the observation unit here at the Brigham for the emergency room. And I just want to say that I've been offering Reiki to my patients, and there's been huge benefits. And I have a patient up there right now that as soon as we're done, I'll be paging Matt. And I'm trying to collect some information, but the people have really, the program's been great. And every time I put a page in, somebody comes up, a volunteer, and is treating these patients in the emergency room. And we've been able to see on some of them that are on the monitors while they're being treated, watch their heart rates go down.
So Dan, I have to ask you, as you relayed your experience and as the stories of the different patient experience were shared here, I'm curious as to what the experience of your oncologist was. As an MD, I'm just thinking, I did not sense how receptive, or perhaps, I imagine there have been adversarial conversations that may have happened around this. And what are those conversations? Did you experience that with your oncologist when you relayed your experience, or did you not even share your narrative, what you shared here, with your providers or even your primary care provider and such? What has been the response?
There was no conversation with my oncologist per se with my experience. Obviously, with the staff, I experienced I shared my experience and told them how beneficial the Reiki experience was for me. The calming effect, the relief that I felt after my initial session, and then I had 2 subsequent sessions which were equally as powerful. But the first one stands out most in my mind. But in answer to your question, no, I did not share that experience with my oncologist, just primarily with staff, family, and friends, and just explained to them that I felt how it was so tremendous, and it was such a great feeling, and it really calmed me down, and I recommended it to everyone I spoke with, and thought it would be beneficial to them, regardless whether they were suffering from cancer or whether there was stress in their life. I think this would be very good for you. I conveyed that at every moment that I could.
Okay. Can other people on the panel here comment on dialogues they've had with, particularly the physician, because it's interesting to have such a powerful experience, and yet the attending a record or responsible attending a record not be aware of it necessarily in the direct way from the patient is, to me, quite striking in some ways, to not hear such this experience or to have a critical dialogue around it. Yeah.
I can speak a little bit to that, having also received a cancer diagnosis about 15 years ago. And I showed up at the hospital to prepare for many hours of surgery. And although I was a Reiki master at the time, I was not able to do my own self-Reiki, but I had a lot of people that were providing it to me, so I wanted to make sure that that continued. And when I made my request to the pre-op nurse that, I need to have my Reiki practitioner available to me in the recovery room, that was not received very well at all. There was a lot of resistance. I was told they don't do that, blah, 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 blah. So I said, well, would it help if I get a doctor's order for this to occur? Well, maybe. So, and they assured me that they would get the doctor's order. So it turned out that no doctor's order was given. But my Reiki practitioner, who had many years' experience as a patient advocate, made sure that I got my Reiki in the recovery room. Also, I received Reiki every day that I was in the hospital, but it was kept mum because we didn't want to create any waves, so to speak. Interestingly enough, not one person, doctor or nurse, ever asked me, why are you not asking for pain medication? I didn't the entire time I was there. I did have a conversation with my doctor about all of this on some of my subsequent follow-up appointments. And my physician was very open. He was not familiar with this. He didn't appear to want to become familiar with this, but I did provide him with Libby's book about hospital Reiki practice. And he continues to be open to whatever it is I do. Not that he embraces it at all, but there is more openness now. I did have to return a few years later for another procedure, and when I made the same request, the response was, oh, just tell her her name and we'll make sure it happens. So in a very few years, there was a difference in attitude in terms of letting people have this in the hospital.
We're actually going to have to clear out this room, but and I'm asked Peter to sort of give a final. I don't know if you had a final comment or.
Sure, I didn't want to take the last word, but first, just really touched by the presentation and so grateful that you guys have permeated the system. I both received Reiki and have been trained in it and other East-West modalities and think there's a lot of richness there. But I wanted to just go back to Darshan's comment about research because I think there's this incredible experiment that's happening. And I think there's this incredible opportunity to sort of capture it with thousands and thousands of patients being treated by hundreds and hundreds of practitioners in different settings with different measurements happening. It's just this natural experiment that's happening. And I think with some thoughtfulness, there can be interesting collaborations that sort of is a win-win for everybody. And I also want to respect that that shouldn't be at the expense, as some of the speakers said, of interfering with the growth of these programs at the same time. So I think there's just this natural collaboration that's just waiting to happen. And I'm happy to help foster that. So anyway, I think that's really
So again, I want to thank our presenters here, and thank you, Dan, for sharing your story with us. We're really grateful. As all of you know, the intentions of these grand rounds is really to center around a patient case to provide a multidisciplinary dialogue. And for those of you in the audience who have ideas of cases that you would like to present, really fostering the interdisciplinary dialogue between science, research, education, and clinical activity. We welcome that. So please come approach myself, Helene, Peter, or Veronica. And at this point, we can still continue this dialogue. I've been told we've been raucous in the past, but if you go across the hall to the sitting area, there's coffee hour and refreshments. Please do continue. And again, we look forward to seeing you next month. Again, the first Tuesday of month, and Mount Auburn Hospital will be presenting an integrative medicine case. So thank you, everyone, and we look forward to seeing you again.